Functional decline is a complex negative consequence of hospitalisation. This deterioration can lead to the patient's inability to complete activities of daily living. This can be a result of loss of physical function and also affect on their cognition, therefore drastically affecting our patient's quality of life. It is associated with an increased longer length of hospital stay, alongside clinical deterioration and the potential for our patients to be discharged to a different setting other than their own homes, therefore again drastically affecting their quality of life. Frailty, cognitive difficulties, a loss of physical function and activity, alongside poor nutritional intake are all significant factors that lead to the functional decline in our patients. What we have established from our local investigations is that if we focus on our patients' cognition, activity and nutrition, we can therefore help to prevent functional decline. And this is what forms the CAN acronym.
Hello, my name is Nick Hume and it's my privilege to be Chief Executive of East Suffolk and North Essex NHS Foundation Trust. Today we want to talk to you about people who stay in hospital too long, people who come into hospital and their health declines simply because they're here. Many of us are lucky enough to go on holiday, but even when we come back we know how important is that first night in our own bed. There is no place like home, there is no bed like our own bed. We want people to get home as quickly as they possibly can and as safely as they possibly can. But most of all because there is a risk for them staying in hospital. We know that people decline physically, emotionally, psychologically if they're in hospital longer than they need to be. Obviously we don't want to send people home who are sick, but as soon as people are well enough to go home, that's what we want to do. Everybody has a role to play in this. It should be our ambition, our drive, our energy to get people home as quickly and as safely as it's possible to do so. So work with us on that. Know that our patients want to be at home. Give them their lives back. Thank you.
Cognition is the mental process by which we know and learn and understand things. It involves things like our memory, our perception, our intelligence, our insight and our problem-solving skills. So cognition becomes impaired, it becomes difficult to navigate life and to understand and relate to the world around us. Cognition can be impacted by disease, by different processes like dementia, delirium, and by mental health issues, or by trauma. So what can we do? We try to see things from the patient's point of view and make adjustments to the way we communicate to their level. We always introduce ourselves and we give lots of motivation by giving plenty of encouragement and being positive. Use of a personal profile such as "This is me" can help to inform care and make our care person centred. Never hurry the person, always give them time and help them to be involved in their care planning where possible. These approaches help a person to feel safe and secure in our care, increase confidence and well-being, and those things are so important for recovery in our patients. Always ask yourself the questions: how would I feel if I was in this person's shoes right now? And how would I want to be treated?
This Is Me is a really important tool for the nursing staff, doctors and any health professionals looking after your loved one to know more about them as a person. It's often used for people who come into hospital who are living with dementia, but actually we can use this for people who have a delirium as well. It tells us all about that person, what their likes and dislikes are, their mobility, what they like to be called.
Low physical activity levels in hospital is an under-recognised epidemic. It has been found that patients perform little to no physical activity at all within in the acute setting. Some national studies have shown that patients are only active as much as 8 minutes per day. This really must change. Being physically active in hospital has an array of health benefits. Some of these include the ability for the body to be strong enough to fight infection. This can also include improving breathing and preventing respiratory infections. It can support bladder and bowel function. Patients even get better sleep when they're more active. If patients get better sleep, they're more comfortable and more independent. This will also contribute to improving their mood. But most importantly, and what we're trying to achieve here, is to make sure these patients remain functioning and able to return back to their own home which therefore improves their quality of life. Promoting our patients' activity levels is actually much easier than you think. This could be the simple factor of just helping them out of their bed and into their chair, or whether it's supporting their independence with eating, washing and dressing. In fact, encouraging your patients to be dressed every day has proven to have many beneficial outcomes. There's been lots of research to show that patients who wear hospital clothing adopt that sick role, making them feel much more worse. They then reside in bed longer, and then unfortunately their levels of activity are significantly reduced. Providing very simple exercises for the patients, or improving their mobility from walking to and from the bathroom alongside walking up and down the ward, helps contribute to that patient's strength and conditioning. However, this also coincides with our patients' dignity, something we always want to uphold and maintain for all of our patients. We need to limit or make sure we review the factor if the patient needs to be catheterised. We also need to ensure that the patients are wearing the right sized incontinence pads if they are required, as this can obviously affect their dignity and also their ability to move freely around the ward. If we take all of this into consideration, these small and simple steps, we can ensure to maintain the activity levels of our patients. It's important that every single one of us are adopting this role and helping to support and maintain our patients' independent function, therefore improving their quality of life and therefore reducing the risk of functional decline.
Low nutritional intake as a result of ill health can lead to weight loss and undernutrition, also referred to as malnutrition. National statistical evidence suggests that 25 to 34% of patients are malnourished when they're admitted to hospital, and 70% weigh less on discharge from hospital. Malnutrition can lead to increased risk of infection, pressure sores, falls, and can also reduce the quality of life that a person might experience, and they'll feel they're less able to participate in daily activities that they normally enjoy. Early identification of malnutrition is important to put strategies in place to improve the quality and quantity of food a person is able to consume. We use the Malnutrition Universal Screening Tool, also referred to as MUST, to enable screening of a patient and to allow a care plan to be formulated, ideally within 24 hours of admission. Once the MUST score has been calculated, a care plan can be formulated, which will enable nursing staff to put strategies in place to allow that patient to improve their nutritional intake. It is also important to have a monitoring plan, and that includes monitoring of the weight on a weekly basis and food and fluid intake on a daily basis. The combination of exercise plus appropriate nutrition is considered the gold standard for maintaining muscle mass and function. Calories and protein can be increased through introducing additional snacks such as yogurt, rice pudding, custard and milky drinks, and encouraging a patient to choose from the high energy menu. Supporting patients with cognitive impairment is important to help them maintain function and increase their independence with eating as much as possible. This might mean introducing adaptive cutlery and crockery, or providing assistance as required. Adequate fluid intake is also really important to maintain hydration, and putting in place appropriate supportive strategies, we aim to improve the quality of nutritional care.
The clinical frailty score that we use within ESNEFT is the Rockwood Clinical Frailty Score. The CFS needs to be performed on all patients over the age of 65 coming into our ED department. The importance of this is to assess their level of current function and also their function before coming into hospital, ideally 2 weeks before. The clinical frailty score assesses their level of function in their mobility and how they manage their everyday daily living.
If you take at least one thing from this video today, whether it's focusing on their cognition, their activity or their nutrition, you will be making a significant impact for those patients' recovery. It's time for every single one of us to help improve that patient's function and their independence, to help reduce the risk of them functionally declining whilst in our care. At the end of the day, we can all help prevent functional decline in hospital.